Hello, everybody. Welcome to the amazing interview with Mark Grant, MA. Hi, Mark. How are you?
I'm wonderful, thank you, Kate. It's a pleasure to be here. I'm looking forward to meeting you and everybody this lovely morning.
Now, I'm just letting you know, everybody, the reason that Mark is here today is that he changed my life. During my concussion journey, I had immense pain, and I discovered his book, Change Your Brain, Change Your Pain, in our local library. And it just transformed my relationship with pain. So, to give you a little bit of a background on this amazing man, Mark is an Australian psychologist slash researcher with 30 years of clinical experience. And as I said, his book, Change Your Pain, Your Brain, Change Your Pain, changed my life. He's pioneered trauma-informed treatment of chronic pain and MUS with EMDR, and we're going to get him to unpack this for you if you haven't heard of it, and lately hypnosis. He's also co-authored 2 chapters regarding EMDR for the Oxford University Press Handbook of EMDR, and it draws on developments about dissociation, neurobiology, and somatic psychology. So he has developed a trauma-informed model culminating in an evidence-based treatment manual. And he's helped sufferers of trauma and pain, including his amazing app, which is Healing Traumatic Stress, which is based on EMDR. So, Mark, thank you so much for being here.
Oh, thank you for that lovely introduction, Kate. It's a thrill to be here, and I'm really looking forward to sharing my little 2 cents worth about trauma and pain from my 30 years in the field. Just quickly,
Beautiful. Yeah.
there are actually 4 apps. It's called the Healing Trauma App Series, and I'll send you a link to a web page where people can find out more about them if they like.
Yeah, that's awesome. We'll pop it in the comments after the interview, for
Sure.
those that are interested, and it's well worth it. And the book
Thank
is
you. Thank you.
amazing. So, what is your background and what led you to study EMDR, and what is it for those of the people watching who haven't come across it?
Sure, sure. Um, so, just to answer the first half of your question first. So, I'm a clinical psychologist, and I got into psychology as a mature age student because of my ADHD, which you know about. I
Yeah, we're
didn't
in the
fare
club
very well
together.
at I didn't do very well at school, but I always wanted to do something in the helping professions, and so I eventually got around to university and figured out how to write an essay and all that. And long story short, and though this is in the what would be early 90s, late 80s, so it was all CBT. And one of my first patients, I got a job in a hospital, was a young woman with chronic pain who'd been in a car accident, and she had just her life was just ruined. And all there really was then was distraction and kind of, helping them manage catastrophizing and learning to live with it, which to me just was not satisfactory. So I explored and got into Ericksonian hypnosis for a while, which was fantastic, but it's not an easy learn. And then EMDR popped onto the scene, and um, it was it was very mysterious and controversial, but it stands for eye movement desensitization and reprocessing. And it was introduced initially as a trauma therapy. And I suppose the mechanics of it are simply that get the patient to think of the traumatic event, which could be anything from, their having a disapproving parent to being physically or sexually abused, and then pairing that with bilateral stimulation and not in every case, but in many cases, it produced a profound and dramatic resolution, really, of their post-traumatic symptoms, including the physiological side of things. Increased arousal and even pain, and it was its impact on physiological symptoms that kind of got my attention, and um, got me thinking this, got me really working with it to develop it as an application for pain. And along the way, I had just tell me to stop if I'm rabbiting on too
Yeah, no,
much.
you're great. Keep going, keep
Okay.
going.
So along the way, I really had a big education about trauma and its effects on the body. And I realized that actually trauma isn't just, being sexually or physically abused, but it's also being emotionally abused. And that a lot of people I saw, yes, they'd had a lot of stressful stuff happen in their life, but things had not really been good from the beginning. They did not have a secure attachment, and so they were deprived of the comfort and the kind of developmental need that every child has for security. So they came into the world in a kind of stressed state and
Mm.
um, in a kind of isolated state, and um, that really sets you up for chronic pain. I can talk a bit more about that in detail as we go along. But getting back to EMDR, everyone goes, "How does it work?" Because it's so radically different to cognitive behavior therapy, for example, or psychoanalysis, that to get someone to think of their upsetting memories and then to focus on bilateral stimulation.
So
And
just unpack bilateral stimulation for those
okay,
in the
yeah,
audience
yeah.
who don't know what it is.
So bilateral stimulation is any visual, auditory, or tactile stimulus, really. And why would you do that? What is that doing? Probably the simplest way to explain it, there are many theories, is that you're activating or what's called the orienting response, or the and sort of, which is part of the fight flight response. So we are all born with an ability to detect environmental stimuli that is called the orienting response. So if you heard a loud bang outside your office right now, you'd immediately turn your head to see what was going on, and that is the orienting response. So it's part of our survival response. So and that gets activated by trauma, whether it's a specific trauma or abuse or neglect, and it remains activated in the nervous system for people who've experienced chronic trauma. So so when we introduce bilateral stimulation in a traumatized person, we're actually kind of hijacking the fight flight response, because the bilateral stimulation is reactivating that orienting response. So they're already activated when they're thinking about their traumatic past. And then
Mm.
you activate it again with the bilateral stimulation. So it's actually hijacking the fight flight response, because
Wow.
when their attention shifts from the traumatic memory and how they feel it in their body to the bilateral stimulation, um, their attention really goes off the traumatic memory and onto the bilateral stimulation that you're delivering in the present. And then what happens is, after about 30 seconds, their brain, and this is all happening in the limbic system, says, "Hey, whatever it is, this is nothing dangerous." And you get a relaxation response. And that's pretty what
Mm.
happens in 99% of people, unless they're highly dissociative, but that's another story.
Mm.
And then that relaxation response, which they're having, which is triggered and which is really physiological, it's just the way your nervous system works, which is triggered in response to biostimulation, now gets paired with the original trauma memory. And then you know, after a few sets, as they call them in EMDR, you go, the client's often feeling calm, relaxed, in the present, in their body, and often in less pain. Then you ask them to think of the trauma, and they go, "Huh?"
Yeah,
And
yeah.
it's amazing. It's sort of amazing, but really, it's just using, really working with the brain, with how it learns, with how it responds to danger, if you like. So look,
As we were talking about Mark, when I met you last week, I was really angry when I read your book.
yeah.
Because what's actually the statistic, Mark? How much of chronic pain is actually in the brain?
Oh, okay. I'd be hard pressed to give you a number, but I'd say it's about 90%, and it's
Yeah, I think that's what you get. And when I read your book,
Mm,
I was having migraines, I had
yeah,
neuropathy, pain in my neck, and I was angry with you when I
yeah,
first this guy's a joke. But then when I actually started listening to the bilateral stimulation, and for those listening on Mark's downloads, it's like sounds that come from ear to ear, and my pain started to decrease.
yeah.
And I think that's for everyone watching, it's so powerful to know that that much of your pain, whether it's emotional or physical, is actually in the brain. It's incredible, Mark.
Mm.
Sorry, carry on. I've totally
No,
ADHD.
no, 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 no. I'm glad you said it because I think our brain is, is doing all this remembering and sensing without our really thinking about it. And while we're feeling these things happen in our body, and it feels as though it's coming from our body, um, after that first, fall or break or fracture, it's all coming from up here.
Yeah.
And our reality is generated from our brain. So
Mm.
but I don't think that's how probably a lot of people think about pain and understand it. So your reaction was quite
Mm.
understandable.
Well, I
But
think that most
yeah,
that, well, myself included, most people will just go to get some painkillers.
yeah,
And then if that pain doesn't, if it doesn't stop the pain, then you get another type or
mm,
you get more.
mm,
And then there's so many people I've met are walking around in pain, whether it's emotional or physical, and they just think it's them,
mm,
right? They
mm,
think that there's no cure.
mm. Yes. That's the sad reality for a lot of people, who have medically unexplained symptoms. It's finding a treating professional who's open to looking at it, in a neurological way, if you like, and then in a
Mm,
psychological way that goes a little bit beyond, having negative thoughts or something like that.
mm, mm.
Um,
So what have you
mm,
seen in your experience in clinic? Because you were telling me a little bit about the clinical trials with the app you've
yeah,
created.
yeah,
What is your experience as a professional? What have you seen EMDR help with, and the
okay.
hypnosis and the bilateral stimulation?
Mm. Um, First thing to say is, I've seen it help with. It's really good with what they call diseases of stress: fibromyalgia, irritable bowel, fatigue. Even sort of, kind of really physical stuff like low back pain. I've even
Mm.
used it to cure a hangover.
Oh, really?
So,
Oh my
but
gosh, listen up, people.
so all kinds of pain, but usually, the stress, particularly the more medically unexplained it is, that, those kind of diseases, what we call diseases of stress. Um, but I've so the only one I've really found it limited with was chronic regional pain syndrome,
Mm,
which is a very, it's a horrible condition that is certainly neurologically driven. Um, so, and that's the short answer. I've seen it really depends. But it's also, it's not just about EMDR works with this kind of pain. It really, as anyone who's a therapist might know, and even if you're a pain sufferer, it's also the individual. I mean, you took the book, and you stuck with it, and so you were curious, you're open-minded, you have access to your emotions, and you're resilient. So there are certain, I guess, quality. It's not just about EMDR; it's about the individual, and if they're willing to commit to something in their own health and well-being, and to stick with it, and so on.
mm.
What I see, and I treat people with. I'm treating a man at the moment who has had a knee had a he has chronic pain in his knee and his lower back. And when I first saw him, he was in bed. He could not get out of bed because of his pain. Um, he um, he had a lot of childhood trauma as a result of being an immigrant from an Asian country,
Well,
and a lot of his problems really were coming from his sort of rigidity about, you've got to be good and work hard, and just his attitude to himself was horrible. And as he's learned, so with EMDR and some other things, and what I'm alluding to here is that it's EMDR plus integrated with hypnosis, somatic therapy, ego state work, because most chronic pain patients have not just had a single accident or trauma, they've got quite complex life trauma histories. Their health has collapsed as a result of, getting injured and, maybe having years and years of unsuccessful medical treatment. So they're not in a good way. And they need, to be frank about it, just EMDR is not enough for
Yeah,
most
it's not
people.
not a magic pill. That's like
No,
I've got a friend who we were talking. Dr. Amen uses the 4 circles, so the physical, the social, the spiritual, and the psychological. And we were unpacking it, and this person turned around and he said it's not one circle, it's all circles
yes.
for healing.
Thank you.
Yeah.
Thank you for, yeah, exactly. Exactly. So the patient comes to you with a symptom, and I think some patients are open to the 4 circles. Some are really just thinking about the physical circle. And
Mm,
part of the healing journey is, of course, is to help them embrace all the circles and attend to their needs across all those dimensions.
mm.
Anyway, this guy is now able to walk 2 kilometers.
Wow.
So yeah, but
Wow.
that's been like a 3-year journey. It was no miracle cure, and he has had some really tough days and some setbacks, but he's stuck with it.
Yeah.
And he's got a much more loving relationship with himself, and that's been absolutely crucial. We can do all the EMDR in the world, but if a person isn't at home with themselves and their own body,
Oh,
it
beautiful.
doesn't work. Yeah.
Yeah. Yeah. So with how can people learn more about EMDR through
Okay.
and I want to drive people towards your new app and
Thank.
website and your book, which I just love. And
Yeah.
I was sharing with you last week, Mark, that quite often I will push some of your soundtracks towards some of my clients, and they've had amazing results.
Yeah.
So how can people actually access these tools?
Well, probably the first port of call is to have a look at my website, www.overcomingpain.com. And this is a ton of information there about EMDR, in the treatment of chronic pain, and some of the trainings I offer for professionals, and also the 4 apps that I've developed for chronic pain / trauma sufferers, and they are overcoming pain, anxiety release, sleep restore, and calm and confident, and they were really addressing the 4 main effects of trauma, which is medically unexplained symptoms. That's that MUS phrase you use in the
Okay,
introduction in
I didn't
case
know what
people
that
don't know.
meant
Yeah,
actually.
medically unexplained symptoms.
I read it out, Mark. I didn't know what
No,
MUS
that's
meant.
all right. I should have said. So the core 4 key effects of trauma, which is also most chronic pain sufferers are having, is medically unexplained symptoms, insomnia, which is very common in it's very common in PTSD sufferers, and insomnia is, as research shows, it's one of the leading contributors to medically unexplained symptoms. Because of course, when we're tired, and if we have an illness or an injury, the pain just seems that much worse.
Mm,
And then we have anxiety, which of course is very, very much a feature of PTSD, and self-esteem, identity issues. So in those people who are sufferers of chronic, complex, long-term trauma, their sense of self is really damaged. They just feel broken and inadequate, and so that the 4th app is really helping people to restore their sense of well-being and confidence and worthwhileness as a person.
mm, mm. Because I can't recommend you enough,
Oh,
and
thank you.
I've bought. It's still coming from Booktopia, but basically your book, and I got it out from the library again.
Oh,
I have been renewing this almost monthly at the library. So anybody who's local has probably even never even seen it because I keep renewing it,
yeah. Oh,
and I think you're understanding how you actually unpack how the brain works in
yeah.
relationship to pain is phenomenal.
Oh, thanks. I appreciate that, Kate. Einstein said, if you can't explain it to a 6-year-old, you don't understand it.
Mm,
And what I mean by that is, as someone who perhaps was academically challenged as a youth, I've really tried to make that the brain stuff very simple, that any lay person can understand. They're not going to be bamboozled by big words and things like that. Like my explanation of EMDR about hijacking the fight-flight response. That's a very, very simple
Yeah.
explanation, but essentially that captures what the method's doing. I don't think the average person needs or wants to know all the details about the amygdala and the periodactyl gray and how they communicate with each other and so on and so on.
Yeah, yeah,
They
yeah.
want
It's
to,
how can it help me? How can it
yeah,
help me?
that's
That's
right,
what
that's
people
right.
want to know.
Yeah. So just the minimum amount of information and understanding. So thank you. That's what I tried to do in the book, was to boil all that information into very simple, accessible
Mm, mm,
terms,
mm,
um, so that that people can apply it and
mm,
understand. I think understand why something like bilateral stimulation, which is a very strange seeming thing to do, why that might be helpful. And
mm.
um,
Because we,
yeah.
oh, sorry, you go.
I just wanted to say, I think one of the strangest and neatest things about EMDR is almost the effort. When you get really down to it, it's effortless.
Mm,
You don't have to do meditation. You don't have to do positive thinking. You don't have to exercise. You just, you attend to the bilateral stimulation, and as you said, the symptoms just seem to melt away or shrink or reduce almost almost effortlessly. And I think it's almost like it shouldn't be this easy.
yeah.
Does that
Well,
make sense?
that's what I found really interesting during my concussion journey because everything was hard. You know,
Mm, mm.
everything was hard. And then when I popped on my headphones and I would listen to your meditations with the bilateral stimulation, it was easy. And
Yeah.
it felt like like my brain didn't have to process another thing,
Mm.
that it was actually, and tell us very briefly if you've got time, Mark, because I read a book on EMDR and the woman who formulated it, she was upset and then she started looking at fence
Oh
thingies.
yes,
Like,
friends.
I
So
read this book and I'm like, oh my God, like, can it be this easy? Tell us that
you're
story.
asking what the story is of how EMDR was discovered.
Yes, it's
Yes, no,
ridiculous.
it's kind of unbelievable because so Francine Shapiro, an American psychologist who's unfortunately now deceased a few years ago, but she had this must have been 40 years ago now, had been diagnosed with cancer, and she was walking the park, obviously not feeling very happy about the state of affairs of her life, and she suddenly sort of, I don't know, sort of lost consciousness for a minute. And then when she came back to herself, all her anxiety had calmed down. And she reflected back, that's odd. And she reflected back and she realized that she'd had what's called a spontaneous burst of saccadic eye movements.
Mm,
And she wondered if that had something to do with her change feelings about her situation. So she, being the sort of curious scientific person that she was, she got some Vietnam veterans in her practice and asked them to think of things and just started inducing eye movements. And they all started reporting these amazing, decreases in their post-traumatic stress um, symptoms. And the rest is history, as they say.
wow. Wow. And it's another one of those things which I look at a lot of things in health. And a lot of the things that work are actually very simple,
Yes, yes, absolutely,
you know?
absolutely. Um,
But being able to have somebody I mean, that's what I loved about your meditations is that it's very different from just sitting there and moving your eyes back and forth yourself rather than listening to a hypnosis or somebody guiding you through the
mm,
process.
mm.
Yeah.
Because you're working with the limbic system and really the brain stem and how it responds to the bilateral stimulation, the therapeutic, the core to it is just letting your body respond to the bilateral stimulation and then interpreting those changes. So I feel calmer, I feel less anxious, I feel sleepy, I feel less discomfort. What does that mean? Well, it means that I can heal. I can learn to control my pain. I am a good person. So it's a sort of two-step process, where you're stimulating physiological changes without having to work, without having to meditate or any of that, and then really integrating those changes into your perception of yourself in relation to whatever the problem is that you're facing, as you would have experienced in your journey from feeling
Mm.
overwhelmed and helpless to feeling, in control and, you
Yeah.
know,
And I think that's what really powerful, Mark. That's what I've seen on my journey, is that quite often we feel like we are broken
yeah.
and that you need a pill or you need something external, but that these tools, like from finding your book, it was a real tool in my pain management.
Mm.
And I
Actually,
think
yeah,
that is a big part of not feeling broken, is
yeah.
actually finding the tools to make us feel empowered again.
Thank you. Actually, that reminds me, of course, that, as great a tool as EMDR is, one of the core principles of EMDR is what's called the adaptive information processing model, which really posits that we all have within us the
Mm.
capacity to heal. And that's so different to Western medicine, which says the doctor will make you better.
Yeah, 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 yeah.
And
If you
so,
can get in.
yeah, so it's not a fluffy, airy fairy idea at all. We do. We're born with a nervous system that is designed to heal, and trauma, of course, smashes that. And so, really, EMDR is just helping us to access a capacity within us, and to activate that. But it does it it does it in that very sophisticated way. But we must be, I want to remind listeners that it's a capacity that is within us all, that
Mm.
just is just waiting to be activated and nourished.
Mm. That's a
And yeah,
beautiful
and
message.
um, that's a really important thing to, I think, to hold in mind. Um, and when we think about medicine, of course, it's not all on you or me to heal myself. It's a collaboration, and we can't do it without, I think a therapist, someone who knows what they're doing and who really cares, and who's been trained in EMDR and maybe hypnosis. This is what actually came out of my app research recently. So we just finished a randomized controlled trial with my 4 apps, and what essentially the simple 2 things we found were that people that used the apps had over a 40% reduction in PTSD symptoms. And these were people who've had PTSD for over 10 years, and a
Wow.
significant reduction in their physical symptoms. However, a lot of people who enrolled in the study just did not use the apps, and they were the people who were not referred or didn't have the support of a therapist. So
Mm.
the takeaway was, um, you can't do it on your own. You,
Mm.
apps are great, but you need a therapist or a support network, to, like, a coach, if you like, to do
Mm.
it.
Mm.
And I went into at the start of this year, I vowed to improve my self-care, and I started yoga classes, and I went every day for January, and, and then I got distracted and missed a couple, and it's gone. So it's very
Whereabouts are you
hard to
going?
develop
Where
new
are you
habits.
going in Melbourne?
Sorry.
Which yoga studio?
Oh, it's called the Ashtanga
Oh, I
yoga.
used to go there too.
Oh, there you go. Yeah, it's a pretty
Yeah,
good
yeah,
studio.
yeah. Yeah, yeah,
But
yeah. I'm
so
pretty sure it would be the same one.
yeah, it would be. So I know it's we
Is it in Albert
uh,
Park?
yeah, no, it's in Brunswick.
Oh, okay. Oh, I think I've been there once. Sorry, I'm sidetracking you.
That's all right. That's all right. Um, so yeah, I think the important thing to say is you can't do it on your own, and um, it, you have it within you, but you need help to bring it forward.
Yeah, yeah, yeah. And I think like anything, like I worked as a personal trainer for a long time, and you'd see the difference with the people that actually had a trainer, somebody to hold them accountable. But I
Absolutely,
found
that's it.
I think from my own experience using your book and listening to the audio, because I was so well, the only reason I was disciplined with it is because it helped me.
Mhm.
you know, so I think that it's finding that we need consistency.
Yes.
And if
Yeah.
if a therapist brings you consistency, then,
Yeah.
you know, then that's a great thing if you can't find that consistency on your own.
You, so I'm hearing that, you found it helpful from the get-go, and that helped you to stay
Yeah.
motivated to stick with it,
Yeah, it's
which is
like
important.
chocolate, Mark. Hey, I wouldn't like eat chocolate if I didn't like the taste of it.
Yeah, actually, that's a good point too, that you're raising, and that is with EMDR. Quite often, if you know what you're doing, it's possible to get a positive result very early in the piece. Whereas with
Mm.
meditation, you've got to stick at it for months to get anything. So the beauty,
Especially if
I
you've
think,
got an ADHD brain like us.
mm, mm.
Like, oh, there's a squirrel.
So for many people that, their first or second experience of EMDR, they're off to the races. They're feeling more relaxed, their pain's reducing, and that gives them that motivation to continue with it. So that's a
Yeah,
good point, as
yeah,
opposed to other methods which just take a lot longer and a lot more hard work.
yeah. Well, as we were talking about last week, the thing that I found really interesting with EMDR, and I'd never heard of it until I found your book in the library, and it was a God-driven moment because I wasn't looking for it, right? But if is that during the concussion, we had to do a lot of saccade work, you know,
Yes.
moving the eyes back and
Oh,
forth
yes.
as
Yeah.
part of rehabbing the brain,
Mm,
you know, so rehabbing balance,
mm.
up and down and side to side. It was all about eye movement.
Yeah. Yeah.
So it's all connected.
Yes. There's also been, just as a researcher, there's been some research comparing EMDR with traditional methods like exposure. And what
Ah,
what what they found was that both methods had roughly equal outcomes, but that EMDR kind of did it in half the time, and with
mm,
with no homework, with a homework,
wow.
no homework. So that's just I think it's just easy. It's just much easier.
Yeah, so that suits people like us that might have mucked around in school and didn't
Yeah,
do our
yeah,
homework.
yeah. Why wouldn't you want to take something that was just take the easier path, and
Yeah,
it's more efficient, which I like efficiency.
yeah.
Yeah.
Well, that's awesome, Mark. Look, thank you so much for your time. I'm aware that you've got a client shortly. So for those of you that are watching, thank you for coming. And I'm going to put the links to Mark's apps in the comments on this video, and also a link to his book. And I highly recommend both of them because it's,
Thank
yeah,
you.
as I said, it was life-changing for me. So if it can help you with your pain, it is worth a go.
Thank you, Kate. Lovely to meet you.
Thank you. Lovely to meet you. I will speak to you shortly.
Okay.
Thanks, Mark. Bye.
Bye.